State's reopening plan takes another major step on Monday. Here to explain what the new rules could mean for your families, Dr. Kristen Moffitt, a specialist in infectious diseases at Boston Children's Hospital. Dr. Moffitt, thanks for the time today.
Sure, thanks for having me.
All right, so Governor Baker announced that this week he will allow indoor spaces such as roller rinks, arcades, trampoline parks to open this Monday in communities with low levels of COVID cases. So what's your advice to parents? Of course, the colder weather is upon us. Would you allow your own children to go to one of these places?
Yeah, I think I would encourage parents to really just consider risks on a couple of different fronts. And one is to consider the risks associated with that setting. So how many people will be in that indoor setting? What is the ventilation like? What kind of activities are going to be done? Can physical distancing still be maintained during those activities? Will people be masked? And then in addition to that, there's the set of risks that's associated with what if there is an exposure that's discovered that was associated with that setting. And not just what does that mean for the people in your household or who you come into contact with. Are any of you more susceptible to severe disease? But what would the impact be if there were an exposure and you or your family had to quarantine for 14 days? Can you still safely do your job, for example? So taking all of those risks together, it would have to be a really pretty specific set of circumstances for me to feel like that was something that was a risk worth taking for my family.
So we did flip the calendar to October today. That means Halloween is less than a month away. A lot of kids are looking forward to it already. I know this has been discussed in my household and in my neighborhood. The CDC released their guidelines, of course, which strongly discourage traditional trick-or-treating. So given our numbers here in Massachusetts and in New England, would it be okay maybe, especially in these lower risk communities, to still go trick-or-treating? It is outdoors after all.
It is outdoors, which is good. It does, in general, feel like it would be a pretty low-risk event. The contacts going door to door are pretty short-lived. But on the other hand, if there were even a single individual who was infectious along that trick-or-treating route, either someone doing the trick-or-treating or someone meeting them at the door to hand out candy, if they were highly infectious, transmission could occur in that way. And most importantly, it would be a contact tracing nightmare. It would be really difficult to be able to assure that public health departments were able to contact everybody associated with that transmission. And that's what makes that a really difficult setting.
So do you have the same concerns about maybe an outdoor costume party or an outdoor parade?
So I think, again, it gets at some of those factors that you can control. So an outdoor costume party, if it was a small enough group of people, you could all stay outside and maintain physical distance. That probably could be done in a fairly low risk way, especially if you knew all of the people well enough to know that they all had been pretty healthy and relatively free of exposures coming into the event, and you could all be in touch with each other after the event in the event that somebody did become sick and there was a possible exposure there.
So maybe find a select group of neighbors and do it that way. All right, Dr. Kristen Moffitt with Children's. Dr. Moffitt, thanks for the time.
Thanks for having me.